Morning, everyone. As introduced, I'm Deborah Mudali, Assistant Professor of Practice in the Department of Computer Science at the University of Tennessee, and I'm also a Research Fellow at the MIH Research Fellowship. I'm going to talk about examining social and behavioral determinants in patients with long COVID-19 and its impact on health disparity. So generally, the COVID-19 pandemic has disproportionately affected marginalized communities, and examining these social determinants that contribute to these disparities is very crucial for improving health outcomes. Studies have demonstrated that social determinants such as race, income, occupation, socioeconomic status have a significant impact on COVID-19 outcomes. And generally, the impact of social determinants of health on disparities in COVID-19 mortality in the United States by Manis found that social determinants were important predictors of COVID-19 mortality rates. So from this feasibility and such studies, examining impact of social determinants on health outcomes have been conducted successfully in the past, and we base our study on this. And these studies provide a framework for examining social determinants in the context of long COVID-19, which is the aftermath of COVID-19, and its impact generally on health disparities. So the research question mainly that we are working on in this study is how do social and behavioral determinants such as socioeconomic status, race, education, access to healthcare, and substance abuse influence the prevalence, severity, and outcomes of long COVID-19, and what is their role in exacerbating health disparities among affected populations. So our aim mainly was to identify these relevant variables from two databases from Oshini and AIMA data breach. And once we are able to identify relative variables from the relevant demographic, social, and behavioral factors, to be able to use these to be able to examine the association of long COVID-19 and to social behavioral demographics factors of health using various statistical tools, machine learning tools, and deep learning models, so that we can be able to identify potential health disparities and associated factors, and of course to be able to validate these models in our performances. So what is the relevancy of to social determinants of health? So again, our primary focus is to investigate how long COVID-19 is influenced by the social, behavioral, and demographic factors of health. And mainly we want to uncover disparities in the prevalence, impact, and outcomes among diverse populations, acknowledging the role of socioeconomic status, race, ethnicity, and healthcare access in health disparities. So with the analysis of determinants, we should be able to yield some variable insights so that we have informed decisions and to be able to understand the distribution and the impacts of the condition. So methods involve, because this is an ongoing study, to be able to collect data, which we already did, reprocess the data, and generate. That's what we are up to right now. We are doing analysis and mainly, again, look at two data sets, Oshini and the AIMA data breach, but we've not yet looked at the AIMA data breach due to the constraint of time. And then we do feature selection because we have several variables, but we want those that are going to actually be able to, that are congruent with long COVID-19, and to use tools like R and Python to do analysis. And then from there, after obtaining the features that are really relevant that we want to look at, to be able to do deduction and induction of learning tools, just like using like R packages such as logistic regression, decision trees, random forest, gradient boosting, neural networks, support vector machines, deep learning, and principal component regression, where we need to aggregate different kind of features. And then we do interpretation, generally analyzing the results obtained from the models to gain variable insights. So the results mainly we looked at so far. We have 4 tables at hand, and we have generally table of demographics, the observation table, we have the location details, and we have the patient estimation. So the demographic table has over 4 million observations. The observation table or the diagnosis has over 223 million patients. It's like a lot. And then facilities has a few. We've not even actually looked at that bit deep. And then we have the patient estimation, which is more like over 3 million. So these are many records, and we already, before even I show the results, we're already having a challenge of the workspace where we supposed to be able to do all the analysis. It kind of, the kernel dies in the process when you're loading a lot of data. So the results I'm going to show you are not like having a lot of data or all of the data. So at some point I was loading all the data and the kernel would die. So I was lucky to have a few results. But in situations where I was like, okay, let me at least have some results for the beginning. Or, I mean, we are still at the analysis phase. So I'm loading just a few records or observations and I go to see what we can be able to learn from the data set. So far, I just applied what we call the GG pairs. So it's mainly, you can be able to look at these different scatter plots, bar plots, and box plots of the different features. So I did this over the VIST features or the encounter features. And if you look here, this is what I can use. There's a highlighter. So just by looking here visually, you see that there's some kind of relationship between the location and federal poverty level percentage dimension. And then there is also an interest in some kind of similarity between the homeless status and the migrant seasonal attribute. So I was like, okay, I should be able to zoom in these two to be able to see more. But again, according to the way the data points are kind of arranged, the workspace was just dying. So I wasn't able to see deeper what these variables have. But I was able to zoom in the homeless status and migrant seasonal status. And so far here you can see that those that are not homeless are being represented more in this particular data set. These are just 10,000 records. And so we can already see that these are more represented, the non-homeless, and you have those that are homeless not well represented in the data set. And then we have the migrant seasonal, those that are not migrants are more represented, and those that are migrants are less represented in here. And then when you look at demographics also, you can see that there is an overrepresentation of the non-Hispanic. If you can look at the attribute of Hispanic, this is non-Hispanic and this is Hispanic. And then you're having also the age distribution. You're seeing that the majority are the young people that are represented in the data set of the 10,000 records so far. And then when you look at the language and the language, this is English language that is more represented, and then this is Spanish. The other languages are almost nowhere to be seen. And when you look at the race, let's look at the next picture, it shows better. So when you look at the race, this race here is race 5. I'll not be able to disclose what it is. And there's this other race here. These ones are the ones that are more represented, but this one is really overwhelmingly represented. The language again here, this is English and this is Spanish, and this is non-Hispanic and this is Hispanic. So non-Hispanic more represented, and then here you have a spike of the young people more represented than the older ones. And this is more or less the same thing I've just explained, but here you have like all the records in there represented. I was able to successfully, at that moment, I was lucky the kernel didn't die, and I was able to see that actually here you can see that still the race, there's this race still being more represented than the other races, and also the non-Hispanic group more represented than the other, and seeing that there's a lot of concentration where there's the young people and the older people with faces away a little bit. And then the poverty level, you're having those that are less than or equal to 100 level being more represented in the data sets, and those that are over 200, not so much in here. So, and then you're having these ones that are not identified in there. So, the majority of patients generally fall into the income category, which is less than or equal to 100. So those that are like the ones that are having a low economic status are more represented the data than those that are actually having higher economic status. Then with the observation data, we were looking to see the diagnosis generally in the data set, but so I was kind of informed that the concept CD was the one that was to show that, but as I go on to read more about the values of the concept CD, it doesn't look like that's the diagnosis, it looks something else. Again, I'm not so much informed in the medical aspect. I want to be able to share this information to medical experts to be able to understand exactly what this concept CD values mean. But so far we see that there's a particular concept that is being represented more than the others. And so this is just data of 10,000 records. But when I was able to load all the data sets, still there was one particular concept that was more represented than the others, and the majority of them were dispersed and not showing so much. So with the location CD, with just half of the records, there's like 2 locations that are outstanding as compared to others. With provider ID, it's kind of having a uniform distribution. There's not so much favoritism of which kind of provider so far with the half of the records. Again, with the concept CD, this is kind of something a little bit that needs to be understood. I've so far just
Dr. Mudali, we need to round up.
Okay, so far I've applied the decision tree predictor, and it's already showing some hope, where you give it a lot of attributes and just a few of them are being used. Like now, Hispanic language and state have been used to be able to identify races, and here a few of the attributes have been used to be able to identify concept CD. So there's future in using the concept ID, the decision tree, to be able to do future prediction. So the initial phase of the Asian data analysis for long COVID-19 reveals significant disparities across age, race, and gender, and age, and then higher female representation is also seen in the sample data set. So, and also we need efficient data processing in the it's very crucial for timely public health responses. So our recommendations to include implementing culturally sensitive interventions for now, gender-specific health policies, age-specific programs, enhanced data analysis tools, and ensuring equitable healthcare access to improve health equity. Again, these results are preliminary as the study is still ongoing, and so we're in our initial phase, so they're not conclusive as such. So I want to acknowledge Emma Head as a research fellow. Thank you everyone for listening.